Hello, everyone. So happy to be here with you today. My name is Rebecca Rowe, and my presentation will be showcasing concept maps, path to critical thinking. I chose the concept map strategy because I see the direct results of how they help students retain and understand concepts and their relationships by organizing ideas and concepts visually. And the more the students gain experiences with patients and information, the more they start connecting those ideas. The students I've worked with and some of the resources in this presentation have substantiated how so many students wish they had this valuable learning tool early on in their nursing program rather than just as faculty mentions them as a study tool. Faculty members may not know enough or feel comfortable enough using concept maps as formal assessments when developing fundamental nursing curriculums. But through my experiences as an adjunct clinical faculty, I can honestly attest using concept maps enhances student engagement as an active learning tool and can be used in a variety of ways to help students start thinking critically like a nurse and start looking at the patients in a whole new way. The goal as educators should be to produce nurses who, beyond passing the NCLEX, are competent to care for patients at the novice level. And one of the most alarming findings and complaints of organizations hiring our graduates is that our new nurses do not have adequate critical thinking skills for novice nurses. So to get them to that point, we need to find better ways to get students to think like nurses. That means nurses that must come to a comprehensive understanding of the nursing process. Following more of a clinical judgment pathway illustrated here that helps meet patients' needs where they are when these students see them, whether in simulation or in real clinical settings. So this presentation aims to provide you with an overview of the concept map and how it is best used and how we as educators can use it to evaluate student knowledge. In the late 1960s and early 70s, a little bit of background here, Joseph Novak and Alberto Cañas performed a 12-year longitudinal study of 191 first-grade students who were followed till they graduated from high school. And the study focused on age-appropriate science topics throughout their years and aimed to support fundamental ideas in David Ausubel's theory of meaningful learning. The basis of Ausubel's theory was that we only acquire new ideas and knowledge when they are important to us. And Ausubel proposed that what determines what a person learns is the type of knowledge they already have. And all the concepts we have in mind are organized into maps. And the new knowledge we acquire is added to them coherently and logically. Ausubel stated that students learn best by consolidating and arranging thoughts rather than by memorizing facts. So this slide shows how Novak and Cañas used a concept map to illustrate to their researching students a key idea in Ausubel's meaningful learning theory. That new theory can contrast from very rote to creative production, meaning that memorization is a low-level meaningful learning, to creative production as high-level meaningful learning. And the amount of commitment involved by both instructor and learning regarding organization, integration, and relevancy of the material being learned is very revealing. The bottom line of their research was the creation of the concept map in the year of 1972. And research on concept mapping continues decades on, demonstrating that meaningful learning is the most important factor in building robust knowledge structures. Rote learning or memorization has little value when building upon knowledge and is not helpful when correcting misinformation held by learners. One of the great things about concept maps is that they can be an effective strategy for students with many different learning styles. So they're very flexible, but some of the disadvantages are that they may not be intuitive to what Billing and Halstead's referred to as concrete thinkers. Auditory learners may also not see this as a favorite activity, but with clear expectations and our structured guidelines and support, concrete thinkers and auditory learners can be guided along with others to start learning how to create a map together. And group work can also help bring in auditory and concrete learners to enjoy this activity either through different assignments or through working together in groups to discuss and participate in this activity. The most fun thing about it is that it's fun, number one, and number two, there's multiple ways to construct a concept map, and it's up to us to choose what's best for the level of students that we're instructing. It's also helpful to use this as a formative evaluation as non-graded rather than a summative evaluation graded until we become more comfortable from a scoring standpoint, because the scoring standpoint is a little bit more of a bottleneck than anything else. And so the point of the exercise for a concept map is to open the mind of the student and gain valuable knowledge and get the students to recall, learn concepts and relationships well after the course has ended. So how does concept mapping promote critical thinking? Well, strategies like concept mapping can be used primarily to teach concepts that spring forth from all the information gained in the classroom. Facts and specifics, they have so many of them in their texts and in resources and research and writing papers and doing all the different assessments that they have. But they can apply that information to their patient care and tests and studying for tests and other assessments. They are getting a fire hose full of information now, and resources are everywhere for them. Secondly, once students start experiencing patients with specific needs and problems and learn more about their physical and social psychological history, they can start to pull nursing theory into that practice area and possibly start looking at the patients in a more holistic approach rather than a disease specific approach. And they can start planning some realistic objectives for their care. In preclinical conferences, pre-simulation preparation, and post-clinical feedback, students can start practicing presentations, gaining experience in receiving feedback, discussions on sequencing treatments, and desired protocols from faculty and peers. And all these safe spaces allow students to start pulling together from these assessments and gain more confidence when presenting when they become nurses that are in the professional arena after licensure. Thirdly, when dealing with a complex physical condition, the concept map is ideal for breaking down details into chunks that can be easier to digest rather than textbook form. This active learning can be performed in groups, like I said, to tackle complex topics, such as something like tackling diabetes or heart failure that have multiple treatment protocols and variables that can cause the students to become overwhelmed when it's taken all in one sitting. Group work on these topics also can help divide and conquer all the different concepts that are included in complex, especially disease-specific topics. And it helps students compile the work, critique each other's work, and enhance students' thinking. Faculty, of course, that's us, must set guidelines and expectations for what should be included in the concept maps. The rubrics are a great way to structure a way for students to know exactly how they will be evaluated for their work, and the rubrics score the individual submissions, ensuring that students are graded fairly on their contribution to the assignment. This slide illustrates an example of heart failure concept map. You can see how complicated it is. And this is one tool that is very helpful for students preparing for high-stakes testing and simulation, so the faculty can evaluate student recall and sequencing of interventions. This is one of those examples that some of my advanced med-surg or senior nursing students stated that they wish they had early on. This map starts separating right and left heart failure alone, which helps distinguish between symptoms and anatomical changes and helps you determine which type of treatments and diagnostics and medications would be expected. This next slide shows an example of a simple concept map which a faculty creates the template for, and this is used in clinical rotation or pharmacology rotation where students review one of their patient assignments for a high alert med, and they thoroughly utilize their online and school resources to gather information to answer the questions that are listed on these concept map nodes. And the clinical instructors prepare the student for the role of educator in nursing. These nurses are to be knowledgeable about the medications their patients are to be taking. And so there are many resources available now online in the nursing unit and within their electronic medical record, for example, Lexicon. And they provide patient education resources for the nursing students to utilize. So each student will present their care map to their peers, and they will explain why the patient's on this medication. Their peers are free to ask questions or to add any information about their experiences with the medication from a personal standpoint or from maybe a family member or a friend that has been on this medication. The clinical instructor can role play and be the patient. So this is a chance for health literacy to be part of the concept. It's not enough just to copy and paste the student to copy and paste from a book or a resource. They need to write these things down so that they, even the act of writing something down into a, a block in this kind of a template can help retain the memory as well. So, and the recall, there's part of a learning process in just the writing of the material. So it's important that they learn how to write in terms that the patient will understand. And it's kind of fun to watch and see how well they try to transpose some of that information from terms that they pull out of a book or a resource and put it in lay terms so that patients can ask the questions and find out what it is that they're talking about. And that interchange can be quite humorous. So I highly recommend that you do that. What happens when the patient is not able to receive the information may be that a family member or a caregiver or a care partner is the one that gets that information. So all of those different type of variables are discussed in a care concept map such as this one. And it's really crucial that during education or patient education about medication, that the nurse student starts thinking like a nurse to be able to um, make sure that they talk to the patients and recognize and have some empathy that the patient is ill and they're probably not in the best shape to recall what you talked about in the hospital. But it's important that they understand simple key concepts about that medication. So when we talk about assessment and evaluation, depending on how you want to utilize and how well students are familiar with the concept mapping task, you can go from high level of direction to a low level of direction. And I created this concept map to show you kind of how this assessment and evaluation portion of talking about this concept map strategy could be broken down. And this is one portion of concept map structure. So some things to consider during planning. If you're willing to accept a hand-drawn concept map, are you going to provide a template or have them fill it in? Are you going to have students learn how to use a concept map program on a computer, create their own? Would you provide a workshop or part of a class or 2-hour class for students required before you start using a grading summative grading assignment for a concept map? The scoring takes time, and you have to be able to make sure that whatever you're designing is going to be simple enough for you to be able to structure your time in the part of the course so that you can make sure that your grades are back to the students so that they can receive that feedback in a timely manner. So there are a couple ways that you can do the scoring. One method is to give points, and you can look at the hierarchies, which is you can look at the concept, and in this particular concept map that I drew out, there's one concept which is about the evaluation and assessment. Underneath that one concept, there's 3 hierarchies, which talks about the way that you structure a concept map, how many tasks there are, what the format looks like, and how many ways there are to score a concept map. So there's 3 ways to do a task, there's 2 ways to do a format, and there's 2 ways to do a presented 2 ways to do a scoring system. The 2 ways to do a scoring system, for example, is to score points. The other method would be to do a rubric. And so for each one of the concepts, there would be 1 point. For each one of the linking relationships, you would have 5 points for each cross-link. For each of the clusters or hierarchies, there would be 10 points. And so you would decide what the maximum amount of points would be for that particular concept. And then another would be a rubric, which in my opinion would be something that is more traditional. It measures the content and the structure of the content map, and it also incorporates the points in that the context of the points, but you're not actually counting points. So you're looking for a minimum number of concepts, a minimum number of hierarchies, and a minimum number of subcontexts and connecting links. So that would be up to you to decide how many based on your construction of the concept map. And it might be a good idea to have another person help you create this concept map as your own assignment first and see if they understand exactly what it is that you're trying to do and what you're trying to achieve. And then once you do that and people take that and work with it in your peer group, then you can decide whether you want to interject that into your class. Best practices are your key concept is the starting point from which all other ideas branch out. So you only want one key concept. Otherwise, you're going to have a very complicated and confusing thing. So you want one key concept. Colors can help differentiate different domains in your concept map. The images and icons can also replace words to help you elicit a deeper recall in what they're seeing in this map. Linking words or phrases could be logical. They have to be logical and added to clarify the relationships between concepts. And this allows readers to form sentences from the linking words in the two concepts. If it makes sense, you can use symbols like a plus or a minus sign to indicate the addition or subtraction of something. And if your general ideas or concepts branch out into too many specific ones, you'd want to consider clustering those ideas. For example, if you construct a concept map about healthy living, you might have two main groups, physical health and mental health. And then below the physical health, you'll have something like exercise and diet. And then on mental health, you'll have something like medications or therapy. Uh, the sky's the limit however you want to do that based on your curriculum and based on the objectives of your course material. Make mapping interactive, either in a group participation or in overall class assignment or in your pairs or in individual supports with each other online. All of those things can be utilized as an interactive class or clinical activity. And then finally, in summary, research over 30 years with concept mapping continues to demonstrate that meaningful learning is, of course, the most important factor in building powerful knowledge structure. And concept mapping is active, it's creative, it's theory-based, constructivist type theory, engaging, and when expectations for parameter are provided, it makes it a very easy and fun activity. It may be very helpful to provide a workshop for faculty on concept mapping to help with scoring, and it's good for all of us to learn how to use these software programs to help design and score maps more efficiently. Concept maps are flexible for multiple learning styles and multiple assessment processes and multiple locations where they can be used: clinical, simulation, prep, and also in classroom setting. And the goal of nursing education, it should promote activities promoting critical thinking and clinical judgment. And concept mapping provides an opportunity for deeper learning of nursing process and for all of those things. And so it also helps students translate that theory into practice. So I highly recommend a concept mapping as a very, very strategic learning method. So I want to thank you for attending this presentation. And my contact information is here at rbrow0812@ung.edu. And my references are here. Thank you so much.